I just remember waking up in the hospital and they told me you had a massive heart attack.
His wife, Dawn Piskevich, remembers everything from that day.
And he was getting a little worried about being able to keep up with the snow.
After completing a small section of driveway, David came inside.
I went down into the basement to do a load of laundry, and I heard him call out, "Babe," like a question. Not painful, just "Babe." And I screamed up, "Yeah." And all of a sudden I heard a shuffle.
He didn't respond.
And all of a sudden I heard a smash. And I flew up the stairs, and there he was at the top of the stairs. I flipped him over. He didn't look good.
Greenfield, please.
She called 911. For the first time, we're hearing that desperate call.
Can you check for a pulse, ma'am?
I'm trying. He keeps taking very shallow breaths. Stand.
Okay, so he's taking shallow breaths. Okay,
Just
stay on the
stand.
phone with me.
I don't think he's gonna make it. Dave! Dave! Oh, God. Dave! Oh, no!
And I told the operator, I think he's gone already.
Ma'am, is he still taking a breath? Can you feel along the neck area, see if there's a pulse?
Anything.
There's no pulse, ma'am?
No.
It's what Greenfield 911 dispatcher Kim Gajewski told Dawn to do next.
Was not hard at all. It is the easiest.
That helped save David's life. She instructed her to perform compression-only CPR.
You can start doing chest compressions, okay?
How many should I do?
Just keep doing chest compressions. If you keep doing chest compressions, at least he's getting some air in, and it's going to help him until we get there.
She said that they were on their way and that I was not to stop until someone moved me over. The police officer arrived first, I believe, and he gently moved me over, and he took over, and then the paramedics were there like right on top of the police officer. So then I moved out of the way and watched them do what they do, and they worked hard.
David beat the odds and survived. The rest of us got to know the story in February through this Twitter post by the Greenfield firefighters. They went back to the house after the call to finish the job that David couldn't. A random act of kindness seen round the world.
We're encouraging our neighbors to be everyday heroes, and if they know somebody that needs some help, go out and shovel their driveway.
Fast forward 8 months, now all Milwaukee County dispatchers are trained to instruct CPR over the phone as new protocol.
We're trained. We want the person to live. That's our goal here, and we're getting help to you.
Greenfield 911, what is your emergency?
Holly Simmons finished her training with the rest of the dispatchers this past summer. Since June, county dispatchers have guided at least 24 callers through the steps.
I feel a lot more confident giving the instructions, so yeah, it feels great to be able to aid in saving someone.
When you wake up in the morning, you need to, hey, how about that? I took a breath, you know? It means a lot. It really does, and a lot of people take it for granted every day.
David and Dawn wouldn't hesitate to help if they saw someone in need.
It's an easy thing for a bystander to do. There's no reason you shouldn't. You have nothing to lose, absolutely nothing. But as a patient, you have everything to lose.
Your perspective on everything changes. It's you don't sweat the small stuff. You just keep on keeping on it.
One of our missions is to provide service to the community. We not only take care of patients who come to this hospital, but we also have a commitment to provide care to the community in general. Every day in our community, there are cases of out-of-hospital cardiac arrest, and the more the community is involved in caring for these patients, the more likely the patients will survive. We're lucky in Milwaukee County because we have an excellent EMT system, and patients can get first responders very quickly to the scene of cardiac arrest events. And this CPR, as it's taught, augments blood flow significantly, and to the point where, for the relatively short period of time, we hope, where emergency services are going to be arriving to apply additional therapy to the patient, it helps to maintain organ perfusion to the point where the patient then can survive the event. So hands-only CPR is an important bridge between the time the patient has an out-of-hospital cardiac arrest and life-saving therapies such as cardiac defibrillation and more advanced cardiac life support systems can be employed. We need to, as a healthcare system, extend training to the community and knowledge of the value of hands-only CPR. Recently at the American Heart Association Heart Walk, Fredericton Medical College trained about 300 people in hands-only CPR. So it's something that is easy to do, it doesn't take long to learn, and we're going to make additional efforts to extend this knowledge to the community at large.
I'm with Lieutenant Dan Tyke from the North Shore Fire Department. Now, Lieutenant, what you have inside this bin can actually help you save a life.
Yeah, inside your bin you'll find a mannequin, a pump for inflating the mannequin, and then an AED or automated external defibrillator, which we'll talk a little bit about later. So the mannequin we're using is a little different than what you'll find in your bin at home, but we're trying to give you a better visual here. So coming upon a victim, the first thing you're going to do is you need to make sure that the scene is safe. So as you approach, take a look around. We don't need you to become another victim. So it's important that you're safe as you approach them. In this case, we know that we're safe. We're going to approach the victim. We're going to tap and shout to try to wake them up. So buddy, buddy, are you okay?
Buddy, buddy, are you okay?
Great. And you don't get any response here, so they're unresponsive, not able to be awakened. You need to get help on the way. So we're going to tell somebody, hopefully a bystander, to call 911 and get an AED if it's available. If you're by yourself, you're going to need to make that call yourself.
So go call 911 and grab the AED.
Great. So the next thing you're going to do is we need to know whether that victim is breathing or not. Normal breathing should be nice and quiet and rhythmic. We know what breathing should sound like. So any abnormal breathing, loud snoring, or the absence of the chest rising and falling is going to tell you that we need to start CPR. So we're going to take a very quick 5-second survey. We don't see any chest rise or fall or any signs that this person's breathing. We need to begin CPR. Need to remove clothing. So in this case, we're going to unzip. Get the bare chest exposed, and that's important. We'll talk about why later. The next thing you're going to do is get your hand placement. So we want your hand to be placed right in the middle of the chest, whichever hand you prefer. Palm down, great. And the next hand needs to go on top of that hand. And we're going to push down hard and fast, and we want at least 100 compressions per minute. Your mannequin at home should give a click to feedback that you've pushed hard enough. So kind of in your head, get that cadence down. We should be getting hopefully about 2 compressions every second. And you have a nice athletic stance, getting your body weight over the victim. That's really important too, because you're going to start to tire out as we approach that 2 minutes. Help will be on scene in Milwaukee County in about 5 minutes. So it's important that you sustain this, or if you have bystanders around you that you can kind of solicit to give you a hand, get them involved. Whether they've been trained or not, you can give them an instruction, because it's really important that you're doing high-quality compressions. So even giving somebody instructions as they walk up on how to do CPR is probably going to provide better compressions than you as you get to the end of that 2 minutes. So you've done what you need to do until help arrives. That's great.
Okay. So that's one way you can help save a life. Are there other ways that can help you increase your odds of survival?
Yeah, so there's a couple options. One, we offer certification classes, Milwaukee County EMS, as well as all of your local fire departments and even some private companies in the area offer certification courses. And in addition, inside of your kit you found that AED we talked about. AEDs are available in airports, a lot of public places, schools, churches, that type of thing. If an AED is available, it gives you instructions step by step on how you need to place it, how you need to turn it on, and it'll even walk you through when to do CPR or when it needs to shock. It's important getting this AED in play if it's available early on.
All right, Lieutenant, thank you, and hopefully this information can help you save a life. So, Lieutenant, you mentioned the AED. What does it stand for and what can it do?
So AED stands for Automated External Defibrillator. There's 2 rhythms that an AED looks for that are what we call shockable rhythms. If the computer chip inside of the AED identifies you're in one of those 2 shockable rhythms, it'll deliver an electrical charge between the 2 pads you're placing on the chest to hopefully actually stop the heart from the rhythm it's in and allow the heart's internal kind of brain to take back over in a normal rhythm. Okay. So the AED you have inside is a trainer that comes inside the red bag. For the purpose of teaching this, I'll have you actually place your hands on the chest like you're doing CPR. And once the AED arrives, it's important you get it into play as soon as possible. So that your AED arrives, you're going to open and unzip. And your trainer needs to have the pads placed. There's pictures on the pads that'll tell you exactly where the AED pads need to go. Some AEDs will include a second set of pads as well. That second set of pads is actually if you have a patient that has some hair on their chest, you need to get that hair out of the way because there needs to be really good contact between the pads. Some AEDs also include a razor for getting the hair out of the way. Great, so now we have the pads in place. The next thing you need to do is turn the AED on. So go ahead and press the green button. It's going to tell you that it's analyzing the heart rhythms.
Analyzing heart rhythm.
And it's going to tell you don't touch the patient.
Do not touch the patient.
That's important because we don't want to send the AED the wrong message to think it's reading a rhythm that doesn't exist.
Shock advised.
So it's now analyzed. It's told us shock advised. The next thing it's going to do is charge to get the electricity into the AED ready to deliver to the victim.
Stay clear of patient.
And once it's charged and ready to shock, it's going to tell you that it needs you to stay clear. We want to make sure nobody is in contact with that victim. So you're going to say, I'm clear, you're clear, we're all clear, and make sure nobody has contact with that patient at all.
So I'm clear, you're clear, we're all clear.
Deliver shock now. Press the orange button now.
And then at that point, you're going to press the orange flashing button.
Shock delivered.
And it tells you it delivered the shock.
Begin CPR.
Now it's going to go right back into CPR. It tells you to begin CPR again. And it's even going to give you the click or the cadence to give CPR. And at the end of 2 minutes, you're going to hear it reanalyze again. At the point it tells you not to touch the patient, you'll again come hands off. And now you know how to use an AED.